Hello everyone, now let us discuss about the key changes made by American Medical Association for 2024 CPT Code Set. And these changes will be effective from 1st January 2024. When we talk about the key changes, there are mainly 5 major changes that have took place. The American Medical Association is taking steps, AMA in simple terms, the AMA is taking steps to improve accessibility for Spanish speaking patients. It is incorporating the Spanish language descriptors for over 11,000 medical procedures and services in the 2024 CPT code set. And coming to the changes, the CPT code set created 349 editorial changes. On a total, 349 editorial changes have been done, including 230 additions, 49 deletions, and 70 revisions. One more change is the COVID-19 immunization reporting has been streamlined. Next, new codes for specific RSV immunizations have been given. And final change is clarifications in the time reported for E&M services were made. Clarifications in the E&M service reportings were made. These are the key changes of 2024. In the current slide, you can find the various 2024 CPT code set updates. New codes have been added for COVID-19 immunizations. They are 91318, 91319, 91320, 91321 and 91322. In addition to that, 90480 was approved for reporting the administration. A new admin code 90480 has been approved for reporting the administration of any COVID-19 vaccine for any patient. Previously, there were different administration codes for different vaccines. Now there is only single admin code for COVID-19 vaccines. Next are the new product specific RSV immunization codes. Respiratory syncytial virus immunization codes are 90380, 90381, 90683, 90678 and 90679. And one more thing is revision of time range in the E&M codes. The revised E&M codes are 99202, 203, 204, 205 and 99212, 213, 214, 215. In addition to that 99306 and 99308. These are the revised codes of E&M services. And finally, coming to deleted codes, they are 99441, which are nothing but telephonic services. They have been deleted. 99441, 99442 and 99443. These are deleted. In addition to that, 0404T, 0501T, 0502T, 0503T, 0504T and 0715T and finally 0775T. These are the deleted codes. Now let us discuss in detail about the COVID-19 immunization changes. The new code 91318 has been added to report the SARS-CoV vaccine mRNA LNP spike protein. Here the dosage, they differ in dosage. Dosage for reporting 91318 is 3 mcg per 0.3 ml. And for reporting 91319, the dosage is 10 mcg per 0.3 ml. And for reporting 91320, the dosage is 30 mcg per 0.3 ml. Next, coming to 91321. These are the codes for product from Moderna. The 91321 is used to report severe acute respiratory syndrome coronavirus SARS-CoV vaccine mRNA LNP. Here the dosage is 25 mcg per 0.25 ml for intramuscular use. And for reporting 91322, the dosage is 50 mcg per 0.5 ml. And as we have discussed earlier, in addition, a new vaccine administration code 90480 was approved for reporting the administration of any COVID-19 vaccine for any patient. replacing all previously approved product-specific vaccine administration codes. Now coming to one more change, that is new codes for specific RSV immunizations. Other novel additions to the CPT code set respond to product-specific innovations in the prevention of respiratory syncytial virus (RSV) that causes acute respiratory infection in individuals of all age groups. 5 new CPT codes have been created to report the product-specific RSV immunizations. They are 90380, 381, 90683, 90679 and 90678 for better tracking, reporting and analysis that supports data-driven planning and allocation. The new codes 90380 and 381 were released in July 2023 and were made immediately effective from July 17, 2023. Now coming to the revisions that are made in ENM codes. The American Medical Association, it eliminated the time ranges. It eliminated the time ranges for office and other outpatient visit codes, which range from 992022 to 99205. These are new patient codes, and 99212 to 99215. These are established patient codes, and made their format consistent with other ENM codes. The next revision is it has set a clear definition for substantive portion in split or shared ENM services. This helps when both a physician and a non-physician practitioner work together on a visit. One more guideline that is revised is introduce the guidelines for using the codes 99234 and 99236 to report the hospital inpatient or observation care services, admission and discharge services when a patient stays for a span of 2 calendar days. One more revision is a revision to nursing facility care codes, which are nothing but 99306 and 99307. The AMA has raised their time thresholds by 5 minutes. In order to report, the increased time is for 99306 it is 50 minutes and for 99307 it is 20 minutes. Revision to nursing facility care codes 99306, that is nothing but initial nursing facility care per day for the evaluation and management of patient, and 99307, that is nothing but subsequent nursing facility care, raising their time thresholds by 5 minutes to 50 and 20 minutes respectively. This is one more revision in the nursing facility care codes. Here you can see previously the E&M outpatient codes, they used to have a time range from 15 minutes to 29 minutes in order to report 99202. And now this time range has been removed. And in order to report 99202 from 2024 onwards, 15 minutes of total time on the date of encounter must be met or exceeded. There is no time range here. And in order to report 99203, 30 minutes must be met or exceeded on the date of encounter. And in order to report 99204, 45 minutes must be met or exceeded. And in order to report 99205, 60 minutes must be met or exceeded. And in order to report 99212, 10 minutes must be met or exceeded. In order to report 99213, 20 minutes must be met or exceeded. And in order to report 99214, 30 minutes must be met or exceeded. And finally, in order to report 99215, 40 minutes must be met or exceeded. Now coming to category 3 codes, new codes have been added in the category 3 codes. The new codes that are added are 0811T2 0815T, 0820T2 0858T and 0864T2 0866T. And also revisions to existing codes have also been done. Revisions are made to 0517T2 0520T. And AMA also updated guidelines and notes for various emerging technologies. These are the changes that have been made for 2024 CPT code set that is effective from 1st January 2024. Thank you for watching. Please subscribe for further videos on medical coding and CPC training.